Hi.
Hi.
My name is Dr. Lux and I'll be your doctor today.
Hi.
Welcome to my practice. Nice to meet you as well. So I see here that we have a 1 p.m. appointment for a head-to-toe examination. May I please have your first name and date of birth?
Lila, April 14th, 1999.
Okay, Lila. Very nice meeting you.
Nice to meet you too.
So when is the last time that you had a head-to-toe assessment performed, Lila?
Oh my goodness. Probably like a year and a half.
A year and a half.
Mm-hmm.
Okay. So I'll be more than happy to take a look at you today. It's very good that you came to see me. Staying on top of your health is very important. Can you please tell me if you have any major medical conditions I should be aware of?
No, nothing really.
Okay. Any headaches or pains in your head that persist, don't go away?
Yeah, I do get some headaches in my temples every once in a while. Like maybe once, twice a week.
Once or twice a week. And do they usually respond to medication, over-the-counter painkillers?
If I take 2 or 3 Advil, usually.
Okay, so they go away with Advil. Okay. How about any blurry vision or double vision?
No.
That's very good. Any tingling sensations in your arms, your face, your legs?
A little bit in my middle finger right here, but that's it.
Right there.
Mm-hmm.
Okay. And for how long does it last when that comes?
Like maybe an hour.
An hour. Interesting. I'll just make a note of this. Okay. Any history of hypertension or elevated blood pressure?
Nope.
Okay. Very good, Lila. So what I'm going to do is I'm going to sanitize my hands and I'm going to check your vital signs, and then we'll begin the head-to-toe assessment, and I'll begin with your head. I'll palpate your head, make sure there are no lumps or bumps, and then I'll move my way down and I'll focus on your eyes, your nose, your mouth, your arms, and your feet.
Great.
So I'm going to sanitize my hands. And are you in any sort of pain right now, Lila?
A little bit of shoulder pain, but other than that, I'm pretty good.
Shoulder pain. Okay. Up here or further down?
Yeah, like right there.
All right. And for how long have you had that for?
Oh, probably a few years.
A few years. Okay, that's good to know. And while I put my gloves on, I'm also going to assess your mental acuity. Do you know what day of the week it is today?
Sunday.
Sunday, excellent. And do you know where you are?
Yes, the doctor's office.
Excellent. And do you remember my name?
Dr. Lux.
Yes, very good. All right, so I'm going to begin by listening to your heart and your lungs. Is it okay if I slide this right under your shirt?
Yes.
Okay. Just relax for me. And I'm listening for any murmurs or abnormal sounds coming from your heart. I'm able to hear S1 and S2. No extra sound, so I'm not hearing S3 and S4. No signs of any heart failure. Excellent. All clear sounds. I'm also going to listen with the bell side. Just continue breathing normally for me. No signs of any murmurs or abnormal sounds. Okay. I'm going to listen to your lungs next. Are you a smoker?
No.
No, good. Okay, every time I touch you with the stethoscope, I want you to take a deep breath in and exhale.
Great.
And No signs of any pneumonia or infiltrate. Not hearing any signs of bronchitis either. Clean sounds. Is it okay if I listen from the back as well? Okay. Take a deep breath in for me and exhale. Deep breath in and exhale. And deep breath in and out. In and out. Excellent. So the base of your lungs sounds healthy and the lower thoracic cavity is giving me excellent sounds. Very good. Okay, what I'm going to do next is check your temperature. Have you had any flu-like symptoms in the last 2 weeks? No? Okay. No runny nose, no cough?
No.
Okay, very good. Just going to go over your forehead and behind your ear. 98.4, so excellent, you don't have a fever. And I'm also going to check your heart rate and the levels of oxygenation in your blood at room temperature with my oximeter here. Just relax for me, take a deep breath in and out. 5, 4, 3, 2, 1. Excellent. So 80 beats per minute. So your heart is very relaxed, it's not overworking, and 99% oxygenation, which is normal. I'm going to check your blood pressure next. Have you ever had this done before?
A few times.
A few times? Okay. So you know what to expect then. Do you have an arm preference, Leila?
I'll do my right.
Okay, let's do this one. Slide it right here. And you can put it in between mine. If you could please hold this up for me. So I read 120/60, which is within normal limits. Very good. I'm gonna slide this right out and I'm gonna place it right here. Alright, Leila, so I'm just going to make a note of the vital signs. Normal temperature and levels of oxygenations, normal heart rate, blood pressure, and clear lung sounds and heart sounds. Excellent. Okay, what I'm going to do next is just take a look at you visually. Make sure that I'm not missing any external sounds. You have a normal temperature, not sweaty, normal color. In normal light conditions, I see that your pupils are round. They have the expected size and shape. Your face is not drooping. Your eyelids are open symmetrically. Eyebrows are symmetric as well. No ptosis around the mouth, no cyanosis. So that's very good. Right, can you please puff out your cheeks for me? Excellent. Keep them puffed. I'm going to try to unpuff them. Don't let me. Excellent. Raise your eyebrows high for me, as high as they go. Keep them raised. Going to attempt to lower them. Don't let me do that. Very good. Now I'm going to try to move your head left and right. Try to keep it straight and don't let me move it. Excellent. Very good. Shrug your shoulders up for me. Keep them up. Excellent. Can you squeeze my hand? Tight, 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 tight. Excellent. Good. Do the okay sign for me. I'm going to attempt to pull through. Don't let me do that. Excellent. That's strong. Spread your fingers wide for me. Keep them like that. I'm going to attempt to bring them together. Don't let me do that. Very good on this hand as well. Very good. Okay, let me just take a look at your arm really quickly. Normal color, no signs of psoriasis. Palmar creases is not pale. No signs of palmar erythema. Capillary refills within 2 seconds, which is normal. You can lower it. May I please have the other one? Normal color again. No signs of edema or psoriasis. No nail clubbing or pitting. No signs of palmar erythema or red palms. Capillary refills within 2 seconds again. So all very normal. Excellent. You can lower this arm. Next up, I'm going to do a facial sensitivity test. I'm going to assess the state of the muscles that control your facial expressions. Can you please close your eyes for me and tell me where I'm touching you on your face?
Forehead.
Excellent. How about now?
Chin.
Very good.
Left cheek.
Yes.
Right cheek. Nose. Lips. Collarbone.
Excellent. And can you please tell me if you feel this equally on both sides of your forehead?
Yep, both sides.
Excellent. V1 is clear. Do you feel this equally on both sides of your cheeks?
Mm-hmm.
V2 is clear. And do you feel this equally on both sides of your jaw?
Yes.
V3 is clear. Excellent. I'm going to also assess your sensitivity to cold. Can you please tell me if you feel this?
Mm-hmm.
Excellent. And can you please tell me where you feel this?
My neck.
Your neck. And how about this one?
My chin.
Excellent. Alright, Leila, so far so good. Next up, I'm going to just assess your head and I'll be feeling for any lumps or bumps, anything out of the ordinary with your head, your neck area. Is that okay?
Yeah.
Okay. Can you just close your eyes for me? I'm just checking your cranial area for symmetry, lumps or bumps. Not feeling any lumps or bumps. And your head is definitely symmetric. Going to check your lymph nodes next. Lymph nodes are not enlarged. Can you look up for me, please? Yes. Trachea is midline. Can you please swallow? Thyroid gland is barely palpable, which is what we want, not enlarged. Very good. Alright, next up I'm going to take a look at the skin of your face. Continue keeping your eyes closed for me. I'm just going to look for micro lesions or anything out of the ordinary with the skin on your face. so your face and the skin on your face looks very normal. I'm not seeing any signs of psoriasis, no lumps, no bumps, nothing out of the ordinary. I'm going to do a quick scalp and hair inspection next. Just continue relaxing for me. You can look over to your left side first and just relax. I'll just be looking for any signs of skin abnormalities. I'm not seeing any signs of psoriasis, ringworm, folliculitis, even hair distribution. The color of your scalp is appropriate to your ethnicity, blends well with the color on your neck and with the skin on your face. No signs of any infestation and no dandruff. I'm going to take a look on this side as well. If you can please look towards your right. Continue keeping your eyes closed and just relax for me. Again, no signs of any infestation, no signs of ringworm, folliculitis, or any abnormalities of the scalp. Very good. All right, Lila. Next up, I'm going to take a look at your eyes. Have you noticed any abnormal pain or discharge with your eyes?
A little bit of pain behind the eyes when I get my headaches, but that's just about it.
Okay. And does the pain usually go away with over-the-counter medication? Yeah? Okay. So close your eyes for me. I'm just going to feel the outside for any lumps or bumps. Let me know if you feel any discomfort when I press down.
Nope.
No pain? Okay, very good. Look up for me. Just going to take a look at the base of your eye. Okay. And look down. Excellent. Look right here. I'm just going to flash my flashlight in your eyes just a couple of times. And across. Excellent. So pupils are round, reactive to light, contract and dilate in a normal way. Can you please cover one eye for me? Just going to check that one more time. So continue looking at the tip of my nose. Very good. Now cover the other one. Look right here. Very good. Excellent. So no signs of concern whatsoever. Next up, I want you to continue to looking at my nose or into my eyes and tell me which fingers I'm moving, from my right hand or my left.
You're right.
Right, very good.
Left. Right. Both.
Very good. Now I want you to mirror me. So touch your nose and keep your finger right there on your nose. And I want you to continue looking in my eyes, so don't break eye contact. And now touch my finger with your finger back to your nose. Touch my finger back to your nose. To my finger back to your nose. Finger, nose, finger, nose. Excellent. Next up, I'm going to assess your binocular vision and the overall mobility of your eyes. So can you please point to the orange pen first. Excellent. And look at the orange pen. And continue looking at the orange pen. Try to keep your head steady. So don't move your head, only use your eyes. And now switch to the red pen and continue following the red pen. So eyes move together, synchronized movements, no skipping or lagging. Excellent. Next up, I'm going to do what's called the lid lag test. So I want you to look right here, keep your head steady and follow the pen. I'm going to drop it really fast. Try to follow it. And one more time. Excellent. So no lid lag noticed. Next up, I want you to continue keeping your head straight. Look at the light and just follow my light with your eyes only while keeping your head steady. I'm going to assess your eye mobility in all 4 quadrants. And I'm going to bring it closer. So continue following the light. Very good. So your binocular vision seems intact. I'm not noting any red flags. Next up, I'm going to assess your optic nerve. So I want you to look in the distance for me right there and just relax. I'm going to come close to your eye and shine my ophthalmoscope light into your eye and take a look at your cornea and your optic nerve. So just look in the distance for me. Look towards your left and right, up and down. Excellent. So optic nerve looks intact, no cornea scratches. I'm going to repeat the same test over on your other eye. So continue looking in the distance for me. No cornea scratches or tears. Optic nerve looks intact. Can you look up for me? No popped veins. Look down, left and right. Excellent. Your optic nerve looks intact. Okay. All right, Leila. Next up, I'd like to assess your vision. So I have here what's called the Snellen chart, and I want you to read this top letter for me.
Okay.
E. Excellent. How about this bottom row here? Can you read it?
L, T, F, P, H.
Excellent. And what color is this?
Red.
How about this one here?
Green.
And can you read the second row starting from the last letter?
T, L.
Excellent. So your vision is intact. I'm going to focus on your ears, your nose, and your throat next. Okay, you can just close your eyes for me. I'm going to just assess the state of your ears, looking for any lumps or bumps, any pain. Do you feel pain when I pull down?
No.
How about when I pinch up?
No.
No? Excellent. Pressing down on your mastoid bone. Pressing down on your mastoid bone behind your ear. Any pain right there?
No.
Okay, very good. Can you please look over to your left? And I'm going to inspect the outside of your ear. No discharge, no abnormal color. All right. Going to attempt to visualize your eardrum. Okay, just relax for me. I'm able to visualize your ear canal Eardrum is normal, well-defined margins, pearly gray color. No abnormal discharge. No cerebral spinal fluid noted in your inner ear. All normal. Okay, I'm going to do the same over on the other ear. Alright, look towards your right for me. Just relax. Visualizing your ear auricle, which is normal. No abnormal discharge or discoloration noted. Okay, I'm going to visualize your ear canal. Eardrum looks intact, well-defined margins. No signs of any infection. Pearly gray color. And no discharge noted. Excellent. Alright, Leila, so the ear canal looks okay, normal tympanic membrane. I'm not able to note any signs of any infection or inflammation in your ear. I'm going to do a hearing test next. So I want you to close your eyes and tell me which ear do you hear a sound with? Left or right?
Right. Left. Left.
Excellent. I have here a tuning fork. I'm going to strike it and cause a sound, a high-pitched sound. And I'm going to place it next to your ear in two different positions. And I want you to tell me which position is louder, position 1 or 2. So this is position 1. And this is position 2.
Position 1.
Excellent. And can you tell me when you stop hearing the sound?
Stopped.
It stopped. Excellent. So I'm going to do the same over on your other ear. Position 1 and position 2. Which one is louder?
Position 1.
Okay. And when does the sound stop?
Now.
Very good. Alright, then now next up I'm going to take a look at your nose, assess your sense of smell, and your mouth, and assess your sense of taste. Have you ever noticed anything abnormal with your nose?
No, it gets a little stuffy in the summer, but that's it.
Okay. So I'm going to give you something to smell.
Okay.
If you could please identify the smell for me.
Like pear.
Pear. Yes, very good. A second smell. If you could please cover one of your nostrils for me and only smell through the other one. And let's see if you can identify this one.
Watermelon?
Watermelon. Very good. So your sense of smell is perfectly normal.
Great.
Right, next up I'd like to take a nose swab. Is that okay? We are required to do this by the clinic with every patient that comes. Through our practice. And this is to check for any potential viral or bacterial infections. So can you please look up for me? That's one sample. And the second sample. Excellent. And we have a lab right here in the clinic and we'll get the results within 24 hours. Alright, next up I'm going to focus on your mouth. Have you ever noticed any abnormal taste or any mixing of the tastes?
No.
No? Okay. And do you have a sore throat right now?
No.
No. Alright. Can you please open your mouth wide for me? Okay. Back of your throat is not inflamed. Normal denture. No cankers or sores in your mouth, which is very good. And I'm going to give you something to taste, and I want you to identify the taste for me. Stick out your tongue for me.
Vanilla.
Vanilla, very good. And I have here Another taste.
Lemon.
Lemon, very good. So everything is okay with your sense of smell and taste. No red flags whatsoever. Alright, Leila, so everything checks out with all 12 of your cranial nerves. I'm not able to find anything abnormal. Next up, I'd like to take a look at your tummy and listen to the sounds of your internal organs with my stethoscope. So can you please lay down for me? Alright, Leila, just relax for me. You can place your arms next to your body. Is it okay if I lift up your shirt and expose your abdomen?
Yes.
Okay, so just relax for me. Okay, I'm going to begin by doing a light palpation, and I'll check for the size and the sizes of your internal organs and any lumps or bumps. Just relax for me, breathe normally. Normal sizes, not noting any lumps or bumps, no masses. Okay, I'm going to listen with my stethoscope. So just breathe normally. So I'm able to hear activity in all 4 quadrants. No swooshing, just normal activity in your tummy. No signs of any concern. Excellent. Next up, I'm going to do a light percussion. So let me know if you feel any pain whatsoever when I'm doing that. Excellent. I'm hearing excellent resonant sounds coming from your internal organs. No signs of any concern. I'm going to focus on your legs next. Any pain when I press down on your calves?
No.
Your legs have a normal temperature. Just going to take a look at the skin. Normal color. No excess swelling. No signs of psoriasis. Capillary refills within 2 seconds here. Same on this leg. I'm going to palpate your plantar region. Let me know if you feel any discomfort. Normal. Going to check your pedal pulse. 2+, and compare it with the one on your other leg. They are synchronized. Can you tell me which leg you feel me touching you, left or right?
Right. Left. Right. Left.
Excellent. And I'm going to check the sensitivity to cold as well. Did you feel that?
Yes.
On which leg did you feel it?
Right.
Excellent. How about this one?
Left.
Very good. Next up, I'm going to do the Babinski test. Negative Babinski, and on this other foot, negative Babinski. Excellent. You can come back up now. Okay, Leila, next up, I'd like to check your reflexes. I have here a medical hammer, and I'm going to strike it on your elbows, your wrists, your knees, and your ankles. So just relax for me. Excellent. Excellent. Very good. Very good. Very good. Excellent. Very good. All right, Leila. So your reflexes are perfectly normal. Your cranial nerves are normal. Abdominal sounds and feet all check out. Finally, I'm going to take a couple of measurements. And I'll start with the circumference of your head. And if you can please extend your arms forward for me. And you can lower your arms now and lift them one more time for me. 1, 5, 9, 8, 7. Excellent. So everything checks out okay, Leila. I'm going to just take a quick note of all the tests we did and the measurements I just took to make sure that we have a good record for you. So all 12 of your cranial nerves are perfectly healthy. Your tummy gave me excellent resonance sounds. No gurgling, no swooshing. Negative Babinski and normal leg inspection. Excellent. So that concludes the assessment for today, Leila. I find you perfectly healthy, no signs of any concern. Do you have any questions for me?
No, I don't think so.
Okay, well, it was so nice seeing you today. Thank you for allowing me to do this examination on you. And I hope to see you again soon.
Great, thank you.
Thank you as well.